I'm Dr. Beverlee Brisbin. I'm a board-certified sports medicine physician at Mid-America Hand to Shoulder Clinic, and I'm going to be talking about osteoporosis. Osteoporosis is thinning of the bone tissue and loss of bone density over time. It's estimated that 20% American females over the age of 50 have osteoporosis. Half of the women over the age of 50 will sustain a fracture of the hip, wrist, or vertebrae, oftentimes requiring surgery or perhaps resulting in chronic pain or loss of function. Bone density loss occurs when either the body is unable to make enough new bone or too much bone is reabsorbed or broken down, or both. Calcium and phosphate are the two minerals necessary for normal bone formation. Loss of bone density occurs gradually over time. Peak bone density is usually achieved when an individual is in their late 20s or early 30s. The greatest rate of bone loss for a female is usually at the age of 50, around the time of menopause, when there is a sharp decrease in estrogen. For males, this is usually around the age of 70, when testosterone levels drop. Oftentimes, a fracture is the first indication that there's loss of bone density, and that fracture may occur with no or minimal trauma. Other risk factors for osteoporosis include chronic medical conditions such as inflammatory arthritis, kidney disease, eating disorders, thyroid disease, and parathyroid disease. Risk may also be increased for individuals taking steroid medications on a daily basis for more than 3 months and those taking certain anti-seizure medications. Other risk factors include vitamin D deficiency, smoking history, sedentary lifestyle, low body weight, family history of osteoporosis, low calcium intake, a history of high alcohol intake. Symptoms often are absent early in the disease, but later there may be associated bone pain. Again, a fracture may be the first indication that there is osteoporosis or loss of bone density. There also may be a loss of height or a stoop posture, which is called a kyphosis. Testing is usually done via bone densitometry or a DEXA scan. It's recommended that all females over the age of 65 be tested. Women over the age of 50 with at least one risk factor for osteoporosis should be tested as well. Men are recommended for testing if they're over 70 and have had a history of vertebral fracture or a history of chronic steroid therapy. DEXA scan results are usually given as normal, osteopenic or mild bone loss, or osteoporosis. Generally, the hip and the lumbar spine are tested, but occasionally the forearm and wrist may be tested as well. Treatment goals include controlling bone pain, limiting or stopping bone loss, and also preventing fracture and minimizing the risk for falls. Lifestyle changes are usually initiated first and include maintaining adequate intake of calcium and vitamin D, either through diet or supplement. Also recommended is weight-bearing activity or resistance exercise, postural training or balance exercises to reduce the risk for fall, smoking cessation, and limiting alcohol consumption. Medications used to treat osteoporosis are recommended if the DEXA scan indicates osteoporosis or if there's a diagnosis of osteopenia or mild bone loss and that individual has sustained a fracture. Classes of medications include bisphosphonates, which may include medicines such as Actonel, Fosamax, and Boniva. These medications may be given on a daily, weekly, monthly, or yearly basis. Other medications include calcitonin or miacalcin, which is generally given as a nasal spray or injection and is frequently used to treat bone pain. Parathyroid hormone, or Forteo, is usually reserved for postmenopausal women with severe osteoporosis and a very high risk for fracture. Raloxifene or Avista is a medication similar to tamoxifen, which is used to treat breast cancer. Hormone replacement therapy, or estrogen, may be initiated as well. Osteoporosis monitoring is usually done every 1 to 2 years. It's usually completed 1 year after the initiation of treatment or medication changes, and biannually thereafter. The best treatment for osteoporosis, however, is prevention and involves maintaining adequate calcium and vitamin D intake throughout life and maintaining overall fitness, including weight-bearing or resistance exercises most days of the week. For more information and to see more educational videos, please go to handtoshoulderclinic.com.